Welcome to Invent Medical's crash course on the 2D and 3D dental chart module. In this video, we'll walk through a general overview of the module, how to select and mark teeth, add treatment procedures, and more. To start creating a chart, first go to the patient profile on the side of any module. Under the Action section, click on Charts. Tap Select Chart to view all available charts. From the chart library, choose the teeth chart. Let's expand the chart to full screen for easier viewing. This is the teeth chart, where you'll view and edit the patient's teeth and procedures. Click and drag anywhere on the model to rotate the view and see the teeth from any angle. You can also simulate opening the mouth using this button for a clearer view of the bite and back teeth. You can also fine-tune exactly how far the mouth opens using this depression angle slider. Selection mode controls how you select teeth on the chart. Let's open it up. You can choose individual tooth, sextant, quadrant, or arch. Also, you can disable multiple selection to only select one at a time. Let's select several teeth at once. Here, 3 teeth are selected together. The Clear Selection button resets every currently selected tooth in one click. Next to that is Display Options, for controlling what's visible on the chart. Click on it to open the controls, where you can hide or show elements. Also, you can switch the numbering system to match your preferred standard. The focus icon next to it recenters and resets the teeth chart view whenever you need it. The pan up and pan down buttons let you move the chart view vertically. Now let's add procedures to the patient's teeth. Let's rotate the view to get a better angle before selecting the next tooth to treat. Click a tooth or multiple to add procedures to it. You can fill in the procedure details manually in the top panel and click Add Procedure, or pick a predefined procedure from the Quick Buttons list below. Distinct visual icons make every treatment instant to spot, and you can freely customize this list to match your clinic's daily workflow. Once added, the dental chart automatically refreshes to visibly display the new procedure on the selected tooth. The exact same quick process works for every procedure, allowing you to easily complete the rest of the teeth. The procedures are now added, with the tooth clearly marked on the chart. We can do the same steps for every tooth that needs treatment for this patient. Moving on now to the Tooth Procedures tab, which shows every procedure for the selected tooth, or all procedures on the chart if nothing's selected. With nothing selected, this shows every procedure planned across the whole chart. Select a specific tooth like this one and the list narrows down to just its procedures. Now the Presence and Dentition tab lets you document a tooth's status in more detail. Here you can quickly update the selected tooth, switch between dentate or edentulous states, and set the patient's overall dentition stage in one click. Let's select missing to mark this tooth as absent from the chart. Once marked missing, the tooth disappears from the chart to reflect its absence. Selecting primary marks that tooth as part of the patient's primary dentition. Once selected, the tooth updates to reflect its new primary dentition status. Now for extra teeth, you can open the Supernumerary Tooth tab right from here. Choose the tooth number closest to where the supernumerary tooth is located. The supernumerary type field lets you specify exactly what kind of extra tooth it is. Clicking Add Supernumerary Tooth saves it directly to the patient's chart. Let's move the chart to see the new tooth that is added. The new supernumerary tooth appears right on the chart. You can edit it by first selecting it, and then you can change the size from here. If you wish to move the tooth, go to this tab to fine-tune the tooth's exact position, shifting, rotating, or tilting it until it looks just right. Watch how adjusting the facial lingual shift value moves the tooth outward in real time. Notice how precisely you can position the tooth this way. Once you're done, deselect to reset the panel, ready to select a new tooth or group. You can also select several teeth at once and adjust their position together, like this group of upper incisors. Adjusting the shift value here moves all 4 selected teeth together in perfect sync. This is especially useful for aligning several teeth in one motion. And here's the result. The whole group repositioned together. Now let's move on to chart annotation. Clicking 2D switches the chart to a flat 2-dimensional view for annotation. The Chart Annotation button opens up tools for editing and annotating the teeth diagram. This panel lets you customize the annotation tools before you start drawing. Click directly on a tooth to drop an annotation marker right where you need it. Let's switch to text to insert text to the chart. Click on the place you wish to add the text. And just like that, the text is added. Switching back to 3D gives you a fuller view of the teeth chart. To wrap up, we can save the chart to the patient documents. From the camera icon, which saves a snapshot of the chart. And that brings us to the end of the crash course on the 3D dental chart, giving you all the tools to document treatments with speed and precision. Thanks for watching. To learn more, check out our documentation page or try the live demo on our website.